Good afternoon, everyone, and thanks again for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us over the line in Saskatoon is SHA CEO Scott Livingston. Both the Premier and the Doctor will have opening remarks, followed by time for questions. Premier?
Well, thank you very much, and good afternoon, everyone. We appreciate you joining us here today. Today we're reporting 7 new additional cases and 4 more recoveries in Saskatchewan, and this means that we are now at 109 active cases in our province. While active cases are still quite low in most parts of the province, they have been rising over the course of the past couple of weeks, particularly in the community of Saskatoon. A number of recent cases in Saskatoon are as a result of one event, a private social gathering that was attended by a number of people. There are now 21 cases that have been traced back to one gathering, and there will likely be a few more in the coming days. This is a clear reminder of why we still have restrictions in place on the size of our group gatherings. It's also a reminder that even if your gathering size is under the 30-person limit, you still have to ensure that there is proper physical distancing measures in place and available. You need to ensure that you are very careful with the service of your food and drinks, and please continue to not shake hands or hug one another, and continue to keep sanitizing and washing your hands. I know we all probably tend to relax those practices when we are in our own home or at a friend's home, a place where we feel comfortable, but those are some of the places that we need to be particularly careful. Most of the large spreader events that we have seen in Saskatchewan to date have been social settings, often involving the service of food and or drinks. And it just takes one infected person in that kind of a setting to pass the virus on to many other guests. Then they go home and they pass that virus on to their family and to other close contacts that they see over the coming days. Before you know it, we have dozens of additional cases. Some of whom may become very, very sick, or some who actually may become hospitalized. And of course, none of us want this to happen. So that's why we have to continue being very careful and cautious, even when we are just visiting with our family and friends. That's how we will keep businesses and services and activities in this province open. It's especially important now that our schools have reopened. So far, we have seen no evidence of the virus being spread within the schools. The protocols the schools have put in place are working, and I would say they're working quite well. So I would say thank you to the students, to the teachers, and to all of the staff for everything that you are doing to ensure that our classrooms are safe. However, if there are more cases in our community, it only stands to reason that some of those cases are going to be students and some will be teachers. And that's how the virus will enter our schools. That's what we have seen at a few schools in Saskatoon. So it also stands to reason that if we keep our case numbers low in our communities, we greatly reduce the chances of this virus getting into our school system. So once again, I want to thank everyone in Saskatchewan for everything that you are doing to keep yourself and others safe. And I ask you to continue doing it. It only takes one infected person letting their guard down at the wrong place, at the wrong time, to cause literally dozens of additional cases. And I know none of us want that to happen. Dr. Shahab?
Thank you, Premier. So I just maybe reinforce some of the key issues from our perspective over the last couple of weeks. So like the Premier mentioned, this is our second week of in-class learning. And while about 6 schools have had a single case each, and a week before opening, there was a school with staff who were, one staff member who was symptomatic, and appropriate public health action was taken. School reopening overall is going smoothly. And again, as long as children and staff who are unwell stay home, the proper protocols are followed. While we expect to see the occasional case or cluster in schools, we certainly look forward to schools continuing as they are with the occasional case and cluster, but otherwise things proceeding smoothly. And again, schools are a reflection of the community, so whenever community transmission goes up, that's puts schools at a higher risk. But overall, In Saskatchewan also our case numbers have been low. There are more active cases right now in Saskatchewan due to radio exposures, large gathering, travel, others who maybe close household contacts of previous cases. But overall in Saskatchewan our active case numbers remain low. And again, I think really want to recognize all the students, parents, and staff who worked so hard to really have a smooth start of the school year. It has started off really on a very strong footing. Saskatchewan also has been on a very strong footing, and hopefully this will continue. It is a marathon, not a sprint, and we really need to, continue in this way for the next several months. And then coming to the issue with the large event, the super spreading event, again, this is exactly why the limits on gatherings at 30 continue, because we know that whenever people are close together, the risk of transmission is high. So when people are planning a Thanksgiving meal, for example, in October, it's important to remain to your extended household if possible. If you are planning a larger event up to 30, think who you're inviting. Why do you want to have this larger event? Will you be able to space people out, serve food safely? That is so important. And that's why these public health orders are in place for private gatherings. In this super spreading event, more than 30 people attended, around 40 plus people attended, with 21 confirmed cases linked to the gathering, and about 160 people now contacts of people who attended the gathering. So things like this can snowball very quickly, and that's what we need to avoid as we move forward, because you can start multiple chains of transmission that can cause secondary infections. In March, there were, before we had restrictions on gathering sizes, we had a few large gatherings where transmission happened. But since that time, we've done really well over the last 6 months. And it's really important that we continue to have that discipline for small private gatherings, respect the numbers and organize events in a safe manner. Having said that, we've also seen that, other sectors of the economy where you have more people in a very organized way, like restaurants and cinemas, places of worship, that has been working really well. We've seen the occasional case, we haven't seen large outbreaks. And that, again, is a testament to the fact that business owners are following the guidelines very well, and customers who are going to those venues are observing the guidelines. And again, we really need to continue that, because that has kept our cases low. And while we may see an occasional case or two, we haven't seen those super spreading events, which we really need to avoid as much as possible. And finally, there's been a lot of concern throughout Canada among young people socializing and seeing an increase in transmission. We haven't seen that in Saskatchewan to that extent. And again, a shout out to young people who really seem to be following the guidelines and being very judicious in terms of socializing. And that really needs to continue. In other parts of the province, it's been the 20 to 29 age group, but now even high school students, as they're going to school in a very organized way. But even if you're socializing after school, sticking to the same consistent group of friends and maintaining that physical distance among people who are not part of your small, consistent circle, I think is going to be really important as well. Thank you.
Thank you, Premier. Thank you, Doctor. We'll now take our first question from the phone line.
We have Phil Tank with the Star Phoenix.
Yeah, good afternoon. I'd like to know why we don't have more detail about the event in Saskatoon, like what the nature of the event was, where in the city it was, what date it took place on, and I'll point to the wake in the Clearwater Dene First Nation over the summer, where we did have that information. I'm just curious whether we could get a few more details about that event.
So where we know all the participants who attended an event, like in this case, and all the participants have been followed up, and it was a private event in a private residence, we would not disclose that information, because we do want to protect the confidentiality of the host and the individuals who attended, even though in this case a fine has been issued. But it is important to protect the confidentiality of the host and others who attended. And we have to recognize that in this case the fine was because it exceeded the 30 limit. And we do want to be careful even with small gatherings. But we have to recognize that even with all the care we take, occasionally there can be a case or a transmission event even with smaller gatherings, and we really do need to respect the confidentiality of individuals in these kind of settings. But of course, when a transmission happens in an event, in a place where you can't track everyone, then of course a public service announcement has occurred, and we've had several of those over the last 2 months. But we have to recognize that whenever we've had public service announcements in grocery stores, other settings, we have not found further transmission chains. And again, this is because if someone who was asymptomatic went to a grocery store and then was symptomatic and was thought by public health that this person was infectious while they visited grocery store, a public service announcement is given. We haven't found chains of transmission. And the reason why we haven't found in those settings is exactly because customers, businesses are following the guidelines, and that's very important as well.
Follow-up, Phil?
Yeah, we saw today in Ontario that they reduced the gathering sizes, both outdoors and indoors, and increased fines for people. We're probably not at the state where they are right now, but is that something that will be considered in the future as we go into fall and there might be more people gathering indoors and that sort of thing?
I would say it's not being considered at this point in time. As Dr. Shahab had just indicated, there was a fine administered here just recently with respect to a violation relative to the case in Saskatoon. It wasn't to the level of what they have introduced in Ontario, and I think what's happening in Ontario is reactive to the situation that they have there. So we don't have a need to have that discussion right now. To be reactive is, by far and away, with the odd exception, the people in this province are adhering to the public health guidelines that are there, and that's important. And as I said in my opening comments, it's doubly important in this time when we have our students, our children that are heading back into their classrooms, and the lower that we are able to keep our COVID-19 infection numbers in our community means the better chance we have of ensuring that it's not entering into our school settings or any of our community settings. So not being discussed at the moment because there isn't a need, but we do understand that the need has arisen for that discussion in Ontario, and they've taken the action that they feel is necessary. Do you have anything to add to that, Doctor?
Yeah, I'd just like to say that, the current limit is 30, but if you're planning, for example, a Thanksgiving supper, do think about who is part of your extended or virtual household, and try to stick to that, because that's worked so well for us. You can meet with up to 3 to 5 households where you can be closer than 2 meters, and that's worked well for us. But if you do want to have a larger gathering, I think it's really important to think through do you have enough space so that people who aren't part of your extended household can sit 2 meters apart. Food should be served plated. People shouldn't be gathering around, a buffet, for example, because that's how transmission happens. People are closer together, and they're not part of your extended household. So that's the most common way in which transmission is happening, and I think that's what we need to protect against. But having said that, we have seen that people can socialize at home in a safe manner, primarily in their extended household. You can go to a restaurant and you sit at a table at a group of 6, and that's worked really well. So, there's lots of opportunities to participate in activities of a social nature in a safe manner, but just, I think, be cautious about those unplanned gatherings where transmission can happen very quickly, 50-60% attack rate.
We'll take our next question from the room. Steph?
I remember, I think it was back in May, where there were 2 events in Saskatoon that exceeded what was then the public gathering limit of 10 people. And at that time, there were questions asked about, will the organizers of those events be fined? And the response from both of you was, no, we're going to focus more on education. But in this case, we see a $2,000 fine levied against the organizer. So what was it about this circumstance that the decision was made to actually kind of fine the organizer?
Sure. I actually don't know the answer as to the differences. I wasn't involved with assessing whether or not the fine was applied. We could find that out, I suppose. I don't know if you have any other details on that, Doctor.
I think, first of all, education is a primary tool, and now it's been 6 months where we have been about 4 months plus where we've been at the 30 gathering limit. So I think people must understand that this is the limit right now. I think there was some safety factor when people were gathering outdoors over the summer. that safety margin no longer exists. So I think we need to be really cautious going forward. And I think this is a cautionary tale for all of us. And it's very unfortunate that this happened. I don't think anyone plans an event with the view that transmission may happen. So it's very unfortunate all around. But I think it just forces us to think through, why are we having a gathering? Where are we having it? Can we space it out? How will we plan it? And certainly not exceed the limits, because for private gatherings where food is served, it is 30, and I think we really need to, now that we're moving indoors, we really need to observe that very strictly.
Follow-up, Steph?
Yeah. Mr. Premier, do you find it frustrating that that gathering of that size happens, and there could be other ones that we're 6 months plus into this, and we're still seeing events like this taking place?
I don't know, but I would say frustrating. It is disappointing that we, do have people that aren't adhering to the public health guidelines, in particular at this point in time when we do have our students going back to school. And as I say, the best way to ensure that we can keep, to the greatest degree possible, keep COVID-19 away from our schools is to keep it at a low infection rate in our communities, and events like this don't help. So, the layers of protection that we have essentially are the public health recommendations that Dr. Shahab has provided, recommendations and the laws that he has put in place. Gathering size is one of those, so that if we do have a positive case, it doesn't grow, it will grow exponentially, but it grows to a smaller number with fewer people available. I think we had talked, in this case, there was likely one positive case with 30 or 40 people at the event, ultimately results in, to date, 21 positive cases and and over 160 people that are now being contact traced. So it can get exponentially to a large number very, very quickly. So gathering size most certainly is one of those layers of protection. The physical distancing that is available at an event like this, the lack of a buffet-style food serving where everyone is touching the same utensils, for example, and ultimately, if you aren't able to physical distance, the usage of masks and the proper hand hygiene. These are all layers of protection, if you will, that are accumulative when you bring them all together. And if you start removing too many of them, you do greatly increase the risk of spread in our communities. So, they're not so much frustrating, but just a little disappointed. But this is, this is how it is. So we will, forge on. We've, by and large, the vast majority of people in this province have been adhering to the public health orders that are in place. For that, we thank them. And it's showing in our numbers. I've said many times the personal responsibility that each of us have in following these guidelines, and most are, speaks to the collective success that we've had across the province. And I think this is yet but one example of when we step outside those guidelines, when one individual or a group of individuals step outside those guidelines, the challenges that we could be facing if we weren't all taking that personal responsibility as seriously as we are.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi. There's information out there that the large gathering we've been hearing about in Saskatoon was a family gathering, and that the cases found in Saskatoon schools are linked to that gathering. Are you able to confirm this and provide any other details in that respect?
So again, I would hesitate to go too much into the details of the gathering. I think we want to talk about private gatherings as a cautionary tale that we can all learn from. And, I have to recognize that even if we have a smaller gathering under 30, even with the best of intentions, occasionally transmission can happen, and we just need to understand that and support each other. And I'd also like to add that actually, even as a guest, if you're invited, if you see that something isn't organized well, it's our duty to then help the host organize things well. And if you work in an occupation where you look after vulnerable people, you need to think twice about even going to gatherings that you are outside your virtual household. So coming to the issue of this, 6 schools with a case, at this point, there may be, I don't have the full information because investigations are ongoing. I think there may be 1 or 2 children linked to a school who were linked to that gathering. So again, this speaks to the fact that you get multiple chains of transmission and you get that snowball effect, but that has been addressed. The children are isolating, and in other situations we've always said that schools will reflect the community, so there may be cases who may be a close household contact of an existing case or linked to travel. So the current active cases in Saskatoon are a combination of linked to this gathering but also linked to interprovincial international travel and cases who were close household contacts of cases notified in the past. So again, there's no single reason why we have 6 schools with a case each. But again, going forwards, I think the principles that if you are in a household with a child or an adult either studying or working in a school and you have symptoms, you should get tested. That ensures that everyone in the household who's a close contact isolates, so that prevents a case presenting in school in the first place. And if your child is unwell, the child stays home. And if public health investigation shows that the child may have gone to school in the 1 or 2 days before developing symptoms, appropriate investigations are done to make sure that close contacts, if there are any in the class, are isolated. And that's what's happening right now. And once we have more information, we'll certainly share that.
Follow up, Lisa?
Yes. Is this the first fine that's been issued in the province for contravening any of the COVID-19 orders? And is this setting a precedent, like anything in the future, there will be fines?
So I think fines and warning letters have been issued in the past, and we can try to get a summary. But I would like to say that we are at a very critical juncture at this point because, again, I have been saying for some time that we have had a very good summer where we've been able to enjoy a lot of things outdoors. But as we move indoors, I think we do need to be extra cautious. I think we can celebrate the fact that our overall case numbers have been low, but as we look around us, I think many jurisdictions are really struggling with rising case numbers. And we need to do everything we can to make sure that our case numbers remain low as we go back to school, go back to work, and socialize within the limits in a way that, while there may be the occasional case or cluster, we keep our overall case numbers low. So I think it is important as we look towards the fall that we, reset our bubble if we have to, if we have people who are going back to school or working with vulnerable people. I think we need to look at all of those things as we enter the fall.
We'll take our next question from the room here. Callie?
Yeah, question for Dr. Shahab. The SHA has started convalescent blood plasma clinical trials. What is the purpose of the trials and how has the enrollment been?
Yeah, so we can certainly get further information on that, but at this point, a lot of the therapies for COVID-19, such as convalescent plasma, remdesivir, or other therapies, have to be enrolled as part of a clinical research project because while some show benefit, they have to be studied in a way that what additional benefit will accrue from, for example, convalescent plasma. So it is important to still evaluate their benefits. But I don't know, Scott, if you have any further information, but we can certainly get further details on that.
Is there a comment from Scott Livingston on the line?
Scott, are you there?
We'll go to a follow-up question, Callie, and we'll try to get Scott on the line.
And when it comes to the $2,000 fine, are we happy with that amount of money? For some people it can be significant. And why just fine the organizers? Obviously 47 people were there, 47 people felt comfortable being around that amount, Why just the organizer? Why not the other participants?
What I like to say is that, ultimately, you start with education, awareness, you look at the situation, and again, I don't want to go into the specifics, but we need to recognize that when you invite friends and family, and if more people show up, it is difficult sometimes to, manage things, and I think we need to think ahead around that. Do we have enough space? What if more people show up? And we need to start thinking about that because I think what we have seen, and I'm not going to talk about this specific event, but what we've seen is across other jurisdictions is the whole spectrum of, on the one hand, people thinking it's a good idea to get together, not thinking through, and transmission happens even if it's under 30 or under the allowed limit in that province, 10, 15 people getting together in a basement, they're not part of your virtual circle, just not thinking through, and then a transmission event happens. And then, of course, attempts to hold an event that really people haven't thought through. So I think it's the whole spectrum, and it's just something that we need to think through. I think, a fine is just one part of the thing. I think, again, I would like to say that, any host who holds an event and something like this happens, I think there's a lot of other aspects to it in terms of, no one wants this to happen at an event, and we really need to think through these if we plan to host an event.
And we'll just go back to the phone line to see if Scott Livingston has a comment on the uptake for the convalescent blood plasma trials.
Yeah, thanks, Jim. Sorry, I didn't get off mute, but I gave a great answer to the question. But just in follow-up, I don't have the specific information about that trial, but I do know that our lab has been involved in a number of trials together with other laboratories across the country as COVID has continued to evolve. And certainly we can provide a summary of that work for the question, and I'll follow up with Dr. Shahab on that.
Thanks, Scott. We'll take our next question from the phone line.
We have Connor O'Donovan with Global.
Yeah, so it's been mentioned a few times today. Colder weather's coming. People are going to be indoors more often. With Thanksgiving, Christmas coming up, and Premier Moe, a few answers ago, you mentioned mask use as a layer of protection against spread. However, right now there's an anti-mask or a No Mask Saskatchewan Facebook group with 2,600 people. Given that masks are a layer of protection, I guess, Dr. Shahab, what would you say to people who are indifferent, skeptical, or against mask use? To convince them that it is safe, it can be effective to prevent infection.
I would just very quickly, I'll turn it over to Dr. Shahab and just say if you don't want to wear a mask, that's fine. But you should stay 2 meters apart from people.
Yeah, and I'll just say that, unless you work in healthcare, wearing a mask does not come naturally. And, you have to get used to carrying a mask and putting it on. And I did that last time. And it takes a few seconds, and it's taking a little longer right now. And that's all it is. And I think we need to really think about this, because when we're in our virtual extended household, and we've all agreed that 3 to 5 households, we can get together, socialize without masks, without physical distancing, that's fine. We've understood that, we won't go to that small gathering if you're unwell, and it's a small gathering. But otherwise, if you're in a setting where you can't maintain that 2 meter distance, and you need to get together in an enclosed space for an extended period of time, whether it's work or leisure. I think this is an additional layer of protection. This is not the only layer of protection, but this is an additional layer. Staying home if you're sick, maintaining that 2 meter distance, washing your hands, being extra cautious when you're eating and drinking. But then this is an additional layer of protection, and this can mean the difference between a surge and no surge. And again, if people are uncomfortable or unhappy with having to do that, I think it's worth thinking through. No one likes to be asked to do something that they're not used to, but at the same time, the evidence is clear that, this simple action can make a dramatic difference in indoor spaces, public spaces, when we're not with people who are part of our extended household.
Connor, I just say to that as well, if people don't like to wear a mask, there's ample opportunity that you shouldn't really have to wear a mask in many of your daily events. It is just a layer of protection, and I think it's two things. It's time for us to just kind of regroup as to why we have made and enacted the public health orders that are in place. They are there for layers of protection to flatten the curve and flatten the spread of this particular virus, so that it doesn't overrun our hospital system. So that and it isn't, thankfully, due to what the people of the province are doing. And what we're finding is the lower that you can keep this infection rate, the less problems you are going to have, challenges like we've seen in other areas of Canada with respect to COVID-19 getting into long-term care centres. We've seen it get into correctional centres in states to the south of us with some fairly negative outcomes. And we have fortunately not experienced that here in Saskatchewan because people have utilized the layers of protection that are available to them and the ones that they can choose. Dr. Shahab had said earlier, the second point I'd make is as the weather turns and we start to head indoors, as we do every fall in this province, whether it's our children back into schools or whether it's us coming from the long walks or whatever we may do to enjoy the beautiful outdoor environment we have here in Saskatchewan. We will be coming indoors more into our recreational centers, our rinks, our homes, our neighbors' homes, our workplaces. This is a time for us to reevaluate, reevaluate our contact circles, to reevaluate our daily routines, to ensure that we can continue to have the success that we have experienced thus far. And that success is totally due to each of us in whatever way we choose, taking the recommendations of Dr. Shahab and his team very, very seriously.
Follow-up, Connor?
Yeah, I guess we've been talking about this large event a lot, and this happened. I'm sure people knew there was fines. There was a chance they could be fined, and obviously nobody wants to get people sick. Nobody wants people to die, but they still did it. I mean, it might be hard for people to kind of not see a time in the future when they can have normal-sized gatherings. So I guess I'd ask, going forward, if say we consistently have low active case numbers this winter, is there an opportunity to ease some of the restrictions that are currently in place to maybe, give some people some hope that if they buckle down now, they have a reward in the foreseeable future?
You want to go ahead and then I'll go after.
Yeah, so certainly I think already, like I mentioned earlier, there's many settings where you can do many things that we've always enjoyed: watch a movie, go to a restaurant. And not that there's zero risk in those settings, but the risk has been very low. So I think already there's lots of things that we can do safely. Private gatherings, especially in the home setting is where, because if you don't have enough space, I think you should think twice about how many people you're inviting. But certainly, many, events with static seating, like, live performance venues, movie halls, they can go up to a third of the capacity, up to 150. And, what we've seen so far is that has worked very well. And certainly that's something that we can look for about how can we move forward in a way that we maintain that configuration and have, that cap in a section, for example. And then, of course, there's other settings such as schools, which are not either private gatherings or a larger gathering. They're very different example of where you have this cohort that is a fixed cohort. So there's lots of models that have been very successful, and we'll continue to look at that. And of course, if our community transmission remains low, then I think it's worth considering what other opportunities can be offered in a safe manner, given the success of our reopening phases so far.
And we'll take our next question from the phone line.
We have Emily Pasiak from CBC.
Hi. The SHA has indicated that around 890 students have consented to taking part in the voluntary in-school testing in PA, Regina, and Saskatoon. I'm wondering how, the ministry or the SHA feels about these numbers. Are they higher or lower than expected?
Maybe I can
Sure, go ahead.
maybe make a comment, and Scott, you could add. I think this was really a form of assurance testing. I think 3 weeks ago, as schools were planning to reopen, we did think that we should maybe select one of the larger urban schools in the 3 large urban centers, Regina, Saskatoon, and PA. And although there was no sense that there would be a case for a cluster in those schools, and there isn't, would this kind of assurance testing be feasible? And I think we need to recognize the work that the SHA staff did, as well as the schools in organizing that. And based on consents, we didn't expect everyone to consent, but it went fairly smoothly from what I've heard. And this really shows the value that in future, if there's a case of cluster in a school, or there's increased community transmission, and there's a need to do testing either within a school, and that's more commonly done in a high school setting where children are old enough to be tested on their own as long as there's consent, or if there's a need to test either in a school, after school hours, or near a school, if there's a issue at a community level, as well as involving the school in future, this really demonstrates that there's flexibility in terms of how testing teams can be deployed and assist in assessing if there's an issue either in a community or in a school or both. And that's worked for us in the past when there's been outbreaks as well. So I think it just demonstrated that this can happen in a very smooth manner within a school setting. And I'll just see if, Scott, you have any comments to add.
Well, just to follow on with what Dr. Shahab said, I think part of the school testing was to see how we would be able to work through it together with the school divisions and the schools in particular. And I think we had a good sample of students. Certainly not, we didn't expect to get everybody, but it will give us some good work forward to figure out what were some of the challenges for families. You know, they had a lot on their mind as kids went back to school, so maybe that was part of it. But it means that we can regroup and take a look at how we will continue to offer this service on an ongoing basis moving forward.
You have a follow-up, Emily?
Yeah, so there's now an Instagram account that looks to be highlighting COVID-19 cases at Saskatoon high schools, and schools look like they're being ranked based on whether or not they have COVID cases present at the school. And I'm wondering if the province has any concern about this type of account, which could maybe cause students to treat COVID in a less serious way.
I would just say we've been through this conversation, not with schools, but with other individuals or groups of individuals in the province, as we have had various outbreaks over the course of the last 6 or 7 months. And Dr. Shahab and myself and others have always stated that, you know, it's very important for us to not stigmatize anyone that is associated with someone that has been tested positive with COVID-19 or anyone that actually has been tested positive with COVID-19. This virus, as we have found out, really doesn't differentiate between who you are, where you are. It does differentiate between what you are doing throughout your day and how it spreads. But it's very important for us to not stigmatize those that may have come in contact with COVID-19, those that may have tested positive, those that even may have been tested and actually tested negative, and for certain not to stigmatize groups of students that are going back to school that are in no way maybe associated with anything to do with COVID-19 via social media. So I would say, you know, the challenge that we're facing is really a generational challenge. I often say it pales in comparison to what generations before us have been faced with, and I think of, you know, a couple of world wars, for example. But this is the challenge that we are faced with today as society, and I think in general we have done a tremendous job here in this province in stepping up and addressing COVID-19 and ensuring that we are not passing this virus off to one another in most cases. And in many cases, virtually all cases, we have not stigmatized people. There have been cases where a little bit has started, but we in Saskatchewan have not stigmatized people, and we have acted in, you know, what I would say is just a true Saskatchewan form in being respectful and being caring. Just understanding that this virus is not selective in who it infects. And so I disappointed to hear that there's, these types of things going on. Disappointed but not surprised, but that there's these types of social media pages that may be out there, and I would ask them to quit. This is a much larger challenge that we are facing than one that should be trivialized by someone with a social media page that is, pointing out where not, and ranking schools or individuals or anything of that matter on some stats that they may have gotten a hold of. Saskatchewan's doing a very great job. I'm very proud of what each and every member of this province is doing, and I ask them to continue as we are at a little bit of a pivotal juncture with our schools opening, our weather turning, and we're heading back indoors. Anything to add to that, Doctor?
We'll take our next question from the room. Steph?
Yeah. Mr. Premier, as you say that we are at this pivotal juncture and we're at a moment in time where mask use is being politicized, there's groups cropping up that are opposed to people wearing them. Mm-hmm. Why are you telling people it's okay that they don't want to wear them? Like, isn't that sending a bit of a problematic message as public health officials nationwide are trying to kind of combat people not following the restrictions?
No, not at all. What I'm saying is if you choose not to wear a mask, you should choose to keep your physical distance from others. If you are feeling symptomatic, you certainly should follow the public health guidelines and not go out, and likely dial 811 and book yourself in for a COVID-19 test at the first opportunity. Masks are a layer of protection. If there are some people that are choosing not to wear those masks, and I would say that they should most certainly choose to not put themselves in a position where they should have that question asked of them as to whether or not they should have a mask on, which means they need to keep their physical distance. That's why when we sit up here that we are seated at the distance that we are, is to ensure that not only are we setting an example of keeping that physical distance, and we've all stumbled on that from time to time, myself included. We need to continue to adhere to the public health orders that are here. There are places where masks are mandatory, and if you choose not to wear one, unfortunately you won't be able to partake in those particular places.
Follow-up, Steph?
Yeah, going back to that $2,000 fine, I understand every circumstance is going to be different, but as people move indoors, this is a really important time to see what actually happens with this virus as outdoor gatherings don't become an option anymore. Can people expect to see more fines or harsher punishments? Like, in some ways, is that period of education over?
Well, there is, Doctor, I'll let you comment on this as well, but there is a relevance, as you say, as we move indoors, as to all of a sudden, then not all of a sudden, but then the size of your gathering space becomes relevant. The size of a gathering space when you're outdoors is very, very different than when you come indoors to a movie theater, for example. And we have set some parameters around those types of gatherings and what 150 people can be in there, given that they have the space to accommodate that size of gathering. There is some questions, and we today even on is there an eye to, as we move forward through this pivotal time and our numbers continue to remain low, should we be having a conversation around, for example, convention centers that can, under normal circumstances, accommodate 500 people? Should we be looking at maybe opening those up to that same 150-person limit? And then, that may be a conversation that we would have at some point once we're through the next number of weeks and maybe month or two. So there are these these conversations around. Is there a way for us to, understanding that we understand the spread of the virus much better today than we did 6 months ago, is there a way for us to further provide that opportunity, lessen the impact in our community actions, impact to our economy, yes, which we are aware of, but also to provide that opportunity for us to have a little bit normal of a life without increasing the risk of the spread of this virus in any way. So this is a time where the next month or two are going to matter. We are coming indoors, and we need to pay attention. Anything to add, Doctor?
And we'll take our last question on the phone line.
We have Peter Lazinski from the PA Herald.
Hi. We're having readers call and email in with concerns about doctors, specifically family doctors, still mostly not seeing patients in person in Prince Albert. It's been very difficult to receive a doctor's appointment. Frustration being teachers back in school, hairdressers seeing clients, dentists seeing clients, and with a safe return to services and work in the province, shouldn't there be safe ways to still see patients, even if they have an earache or sore throat, or if they need prescription beyond just phone consultations?
We'll go to
Dr. Shahab or Scott Livingston. Scott, are you there?
I am. The questions around private practice physician offices, and I guess, we have been working with family physicians like we have our own primary care providers, and many have reestablished services looking at PPE use and public health restrictions and how to do that safely within their office. Certainly, virtual care is still a big component of how we're providing care, but I can't speak specifically to individual physicians and the choices that they're making with respect to their offices, but certainly we do know across the province through service resumption, many physicians are getting back to the office, but not in the same way before COVID. So there are restrictions and protocols for them to follow. So, without knowing specific details, but of the clinics you're referring to, but certainly we could follow up. But again, they're not under the umbrella of the SHA, but certainly we have had conversations with the Saskatchewan Medical Association and physicians across the province as we open some of our primary care sites to more fuller services across the province.
You have a follow-up, Peter?
Yeah, the other question we're getting lost right now is if the province is working on putting out guidelines regarding Halloween. Of course, Halloween's coming up in October, and that's an event with typically with lots of people going door to door and running into lots of other people. We're wondering if there's guidelines or thoughts or comments coming with the province ahead of that.
So guidelines on Halloween, and what is the other?
It was basically Halloween.
Yeah, so there are already guidelines on many things, but we will be issuing some guidance on Halloween. And again, for Thanksgiving suppers, again, it's a small gathering that you have to plan ahead. Keep it to your extended household or your virtual bubble as much as possible. But certainly for fall events, there will be, and for the Christmas and holiday season, there will be guidelines developed as required.
Thanks very much for joining us today, everyone. That concludes your time.